Welcome to the ICU Podcast, where we explore the vestibular experience through conversations between patients and the health professionals who care for them.
During this podcast, we invite patients to share their stories and healthcare professionals to ask questions so they are equipped to better care for and truly see the invisible challenges faced by their patients. I'm Kimberly Warner.
And I'm Cynthia Ryan, and we are your hosts on this journey of discovery.
Welcome, everyone, to another episode of the ICU Podcast. This is exciting. This is the end of our third year of the ICU Podcast, Cynthia just reminded me. So we're very happy you're here. Today, we are exploring how yoga can be a powerful and complementary tool for improving balance in people with vestibular disorders and a lot of other things too, we know. Vestibular conditions disrupt the delicate interplay between the inner ear, vision, and somatosensory systems, often leading to dizziness, instability, and compensatory stiffness. Yoga offers a gentle, embodied pathway to retrain balance by engaging controlled movement, focused breathing, and meditative awareness, all of which can help patients recalibrate their vestibular reflexes, reduce dizziness episodes, and restore coordination and confidence in movement. So after this episode, I hope we are all feeling a lot more relaxed and taking deeper breaths. I'm going to start by introducing you to Emma Rodgers. She is our patient guest today, also featured in the Life Rebalance Chronicles. So Emma is a certified yoga teacher originally from the UK and now based in Melbourne, Australia. Emma's journey began with finding yoga and meditation incredibly beneficial for managing her own symptoms of vestibular migraine and PPPD, which led her to train as a teacher. She uses her personal experience to inform her teaching style, making it more accessible through safe, gentle practices. So welcome, Emma. And I'm so excited you're in Melbourne. I was like, she's from the UK, but did she just say Australia? So that's exciting.
Yeah, I moved 2 years ago, nearly 2 years. So yeah, it's gone quite fast.
Lovely. Welcome.
We can hear more
Thank
about that somewhere in our discussion.
Yeah.
Well, I'm going to introduce our next guest, Denise Schneider, who is a physical therapist. She's been practicing in outpatient orthopedic clinics for 23 years. During this time, she's furthered her education to receive a doctorate in physical therapy, a fellowship degree in differential diagnosis and manual therapy, a certificate in vestibular rehabilitation, and a certificate in dry needling, which I'd love to hear about. She received her 200-hour yoga training certification in 2023, and since then she's taught various classes that utilize this knowledge in her physical therapy practice. So Denise is dedicated to providing the utmost vestibular patient experience by incorporating evidence-based practice and individualized care to include all aspects of one's health and well-being. She is a proud ambassador of VITA and contributor to VITA's content. She often helps me write and review our blog posts and other articles. So thank you, Denise, and welcome.
Thank you.
Well, like we always do, let's jump in with hearing a little bit of Emma's story. I know your story quite intimately after working with you, but let's hear back up. I want to know, first of all, how are you today? And then tell us a little bit about your personal journey with vestibular migraine and PPPD, and then how yoga came to play in all of this.
Yeah, no problem. So it's weird because I'm at the point in my kind of vestibular journey where I don't actually talk loads about my recovery anymore because I'm living such a consistent quality of life now, which I'm so grateful for. But, you know, I'm kind of 7 years post my first symptoms. So I'm now, I'm doing pretty good. I would say I have my dizzy days and I have symptoms that I have to kind of ride, as the day goes. But I relocated to the other side of the world. So my dizziness has not held me back in any of my kind of personal goals in life. And I'm in a good place at the moment, which is great.
That's amazing to hear.
Yeah, I'm happy. I'm grateful. I'm very, very grateful. But in terms of where I started, so it was 2018. I used to be a primary school teacher. And for any teachers that are listening to this, they will know what a crazy, overwhelming, all-consuming job it is. Very rewarding job, but a very consuming job. And me being the perfectionist that I am, wanted to do everything, to a very high level. And I was burning the candle at both ends, staying up late, doing work, waking up early. Classroom environments are very overstimulating with the noise and the sound and the movement. And I was already a migraine sufferer. So I'd had migraine with aura since being a teenager. So I'd had a kind of experience of some kind of visual issues when I'd had those episodes, but they were very short-lived, maybe only an hour or so at a time. And then kind of at the peak of me, I guess, pushing my body in teaching, my body just kind of went, we're not, something's got to give. And it happened very, very suddenly and very instantly. And I can remember the exact moment that my entire life just completely changed. And I thought it would be, with health conditions, it would be a gradual thing. But for me, and I think a lot of other patients, it was a split second. And it was just like, I think I always describe it as like a dark shadow just came down and it just never lifted. And I think that's the scariest part of it, is that you just don't feel normal for a very long time afterwards. So the initial, stages were really hard. I had no idea what was going on with my body, never heard of balance disorders before, never heard of anybody with any issues remotely like it. And I think a lot of patients can relate to that, of just feeling like lost and frightened. And you go to the doctor, they have a couple of suggestions, they do their best, but ultimately they can't really pinpoint exactly what it is. I had a lot of time off work. I was, signed off work for months and then eventually left teaching because I just couldn't. I kept trying to go back and I couldn't, because my body was just in such a state of, I think, panic and disorientation that I just couldn't do. I couldn't do it anymore. And then I didn't get a diagnosis for about probably a year and a half into that. It was a lot of different appointments, a lot of money, chiropractors, neurologists, ENTs, you name it. I went to see them. If someone mentioned something and there was a little bit of hope that they were going to be able to help me, I would go to them. It was actually the online community that kind of pointed me in the right direction to what my diagnosis might have been. And this idea of vestibular migraine was mentioned to me. And I was like, these symptoms are sounding very familiar, particularly the kind of spaced out feeling, which I could not describe to anybody else. I was like, I can't describe it to you, but it's almost like I'm not here, which then when you say it out loud sounds a bit strange. But other patients will definitely relate to that feeling. So I kind of followed the community in terms of, next steps and who I could see, and eventually did get my diagnosis of vestibular migraine, and kind of been on the journey since, just, trial and error, lots of different treatments. And in the very early days when I wasn't leaving the house, even walking was beyond anything that I could have done, I found yoga, and I was like, okay, well, that feels kind of safe because I'm in my own home. Maybe that's something I can do. I could, just roll them out on my living room floor. And I'll just give it a go, because I knew that movement was something that I had to do. But if walking's scary, I was like, there must be something else. So yoga became something that I very, very slowly started to do. And it was very challenging at first, but it got easier as time went on. That's kind of my, I guess, start, middle, and a little bit of where I'm at now.
Wow.
I love that you start out by saying how you feel great today, how
Yeah.
you have more good days than bad days today, but that, you came from this place of darkness. And I think that hopefully for some of the people out there who are listening, who are in that place of darkness, gives them hope that
Yeah.
there is a path
Mhm.
to getting to a place where you have a good life and
Yeah.
not
Yeah.
just a scraping by life. So
I just spoke with a filmmaker in LA who just recently developed symptoms, and she's not able to look at screens. She had to move in with like family, and I forgot because it's been 10 years now, but as soon as I said it gets better, I could see something come back in her, like,
Mm,
really? Like, it can get better? And that
yeah.
I remember the same thing, like, oh, you're right. We don't know that's possible, and we really need to know that.
Yeah. And you see a lot of, I was seeing a lot of information about the worst case scenario. So, people saying, I've been struggling with this for 20 years, that, my whole life, and I've got no quality. And I think you see a lot of the negative stuff online as well, which doesn't help in that situation. And then you really hold on to those little glimmers of light of someone saying, do you know what, I've actually come out the other side, and I'm feeling better, and I'm good, and I'm working, and I'm living my life again. And I think that's why it's so important for spaces like this to share those positive stories, because they can be what get you out of bed on your hard day, just knowing that somebody else has done it before you and been successful.
yeah. And sometimes even doctors say to a patient, well, here's your diagnosis, but there's nothing I can do for you. And that
Mm-hmm.
is, even that can just be so disheartening. And I know that a lot of patients, if they get directed to vestibular rehabilitation therapy, I think they get more support. I think
Mhm.
vestibular rehab specialists really are the patient's support network and
Allies.
heroes, allies. Yeah, that's a good
Mhm.
term. And kind of on that note, I want to ask you, Denise. I mean, you practice conventional vestibular rehabilitation. How do you see yoga complementing that?
So in vestibular rehab, there's so many overlaps. We focus on balance and proprioception, so body awareness and space, also mindfulness, relaxation, postural and core strength. So if I'm working with a various patient, yoga can come into play at certain points in their rehab. So if somebody is more sensitized and we need to calm their system down, we can guide them in meditation and mindfulness, part of it, versus somebody who is a little bit still working on that, but maybe beyond that, maybe more getting into movement oriented. We can direct them with gentler flows or gentler yoga, such as sitting yoga in the seated position or mat yoga. And then also when patients become more, they can move more, their balance is better, they're more appropriate for vinyasas, more of a flow type of program. So I feel like there's a lot of overlap and a lot of complementary overlaps there.
Yeah.
So am I hearing you say that, you're using terms like mindfulness and gentle movement, and it sounds like that in some ways that is a part of regular vestibular rehabilitation, but just not with those words, right?
Yes, yes, yes. And I do have for the patients that aren't quite, they don't know much about yoga or aren't into it or have preconceived notions about what yoga is. I sprinkle in some yoga strategies and because I'm a therapist, we don't use yoga terms specifically. We utilize physical therapy related terms. But I do have so many patients that are into yoga and want to get back to yoga, and that's where there's more facilitation towards yoga, if it's something in the clinic or if it's something online or something local in the neighborhood.
It's funny you say that some people aren't, you don't use yoga terms with everybody. And I will tell you
Mhm.
this, just a funny story. My husband is currently in vestibular rehabilitation. He's seeing a
Oh,
vestibular rehab
Wow.
PT right now, and he hates yoga. So
oh,
you would be one of those people that you'd kind of have to slip it in there and not
yeah.
tell him this is what you're doing.
And it is so interesting that that people do think of it a certain way that it's not, or they think it's just meditation, or they think people just don't know until they're educated on what it really is.
Well, and there's so many different forms, and then there's so many different
Yeah.
aspects within those forms. And I'm curious, Emma, within all of this diversity of yoga, what did you find the most helpful for you when you were working with your own dizziness?
I mean, I started off by doing, it must have been 5 or 10 minute YouTube videos.
Mm.
And as Denise mentioned, it was very floor based. So I felt safe on the floor because I was like, I can't fall over if I'm already on the floor.
Mhm.
So I kept it very kind of, low to the ground. And it would be anything with the word slow flow, gentle flow, because I think a lot of the yoga classes that are, I guess, maybe seen a lot on, TV or on Instagram, it's these kind of quite quick vinyasa and people are doing, crazy balances, which are really cool. And, I would love to be able to do some of those one day. But I think when you're starting off, that's the overwhelming kind of fear of, well,
Mhm.
I'm already dizzy. Why on earth would I be trying to stand on one leg and, put myself in that kind of scary position? So I think just really peeling it back and making it really short kind of sessions, trying 10 minutes of yoga rather than a 45-minute class. Things that are slow, things that are gentle, things that incorporate the meditation and the breath work as well, because that is really, I think, what really helped me in my day-to-day life. I'd do the movement on the mat, but then when I was feeling overwhelmed and dizzy and I was on public transport, the meditation and the breath work is what I could quietly do to myself to calm myself down. So it kind of does really help you in your everyday life as well, rather than just on the mat.
Mhm.
Wow.
And I think you make a good point too. Like, why would you want to do it if it makes you feel dizzy? And that's a big
Mm-hmm.
conversation too that we have in the clinic because people are afraid to move, and just exactly like your story. So it's a lot of patient education and easing them into some things that they might provoke their symptoms a little bit, but we ease them into, like, nudge them into certain positions or situations, but not to overload or stress out their system. So it could be little increments, like you were saying, a little bit at once versus like a whole big thing of a lot of movements and a long period of time.
Yeah.
Well, that's actually a great segue into the next question I had for you, Denise, which is um, from a clinical perspective, what are some safety considerations or red flags when introducing a yoga practice to a patient with vestibular dysfunction? And Emma, you touched on that a little bit, starting on the ground so that you're not
Mhm.
afraid of falling. Other
Yeah.
techniques?
So definitely anything balance wise, taking into consideration if we can if we're having them do something standing, having a chair close by, but maybe they're appropriate for mat or sitting to begin with, and making sure they feel safe too, because I can look at them and do their exam and say, oh, you would be fine to do something standing. But if they don't feel safe, then it's again providing the patient education and easing them into positions where they also feel safe and comfortable and their balance isn't a risk. And then also different positions such as downward facing dog might not be a great position for somebody who gets symptomatic when they bend down or change head positions. Utilization of eye positions. So some people are more comfortable with their eyes closed, some people more comfortable with their eyes open, focusing on something. So we would take that into consideration. Also, environmental considerations. So, there may be patients who have issues in crowded areas. So, in a PT clinic, if it's a busy day, that's a cluttered area, a busy environment, not good for particular people with vestibular disorders. So, we would take into consideration the days or the times that we schedule. Um, and then One last thing is somebody with, say, vestibular migraine, they may be sensitive to smells, lights, and other environmental things too that we would take into consideration with this population.
Yeah, all really good points. Oh, Kimberly, I
I
think
muted my mic. Sorry. I'm curious if both of you can chime in this, or one of you. Another thing that I've learned about for those that have hypermobility, or on the more extreme, the Ehlers-Danlos syndrome, I've been hearing more and more from the patient community that stretching, which doesn't necessarily mean yoga. When we talk about yoga, I think some people immediately go to stretching. So they're like, I can't do yoga, because people in the hypermobility community need that connective tissue to actually be somewhat embracing of their nervous system. So the more they stretch, they can actually put themselves into a sympathetic state, is what I've heard, because you're overstretching and your body already has too much of that loosey-goosey thing. And so what it needs is more containment and weightlifting and all of that. This is just something that I've learned and hearsay. I'm curious, do you guys have anything to weigh in on any of the hypermobile or EDS patients?
I would say I have not had a patient with EDS, or I haven't had too many. I have one now who's in therapy for something else, but she actually does do yoga. So we talk more about avoiding the end range positions. And she does more of yoga flow, but yeah, I don't have too much
Yeah.
experience.
I was just wondering if there's a correlation. I know for myself, I'll just speak for myself. I have hypermobility, and I used to be extremely flexible. And I've noticed that my vestibular symptoms have gotten better as I've lessened my end range yoga stretches. And it's like that my nervous system needs, and many vestibular patients need, that sense of groundedness and containment instead of this like complete open, whatever. So anyway, I just wanted to bring that up. I'm curious. I'm glad that you said that, Denise. Let's see, Emma. So when you're designing a yoga class, you have, especially for people that have dizziness, is there any sort of modifications that you might use specifically for them?
Yeah, I mean, I learned a lot from my own practice, because especially when I was doing my teacher training, I did that in 2021, I think that was, so a few years ago now. And I really wasn't in the place that I was in now. So I was still having more dizzy days. So I was but I was in a very supportive environment, because I was with other people training to be yoga teachers. I made sure everybody else was aware of, some of the symptoms that I might have. And it really kind of gave me space to develop my own personal practice that felt good for me. And then that's, I guess, allowed me to go, oh, actually, maybe other people might benefit from some of these prompts. And even if they don't have dizziness necessarily, somebody that has other health issues, it might be an option that feels better for them. So things, for example, rather than having your legs, if you were stood up, rather than having your legs kind of next to each other, widening the stance, and kind of spreading the toes, allows you to feel a bit more grounded. I always felt much better with barefoot. And again, I think it's that contact on the floor of just feeling that grounded feeling. As Denise mentioned with the eyes, I would find that I was okay having my eyes opened and closed, but I would just need to take a second before I opened them. So if I was going to come up from a forward fold, for example, I might come up with my eyes closed, and then I would just pause for a few seconds and then slowly open my eyes. And it was just kind of going, okay, well, that seems to help me feel a bit steadier. It allows everything to settle, rather than this kind of quick head turns, eyes open, eyes closed, up, down, kind of, that was what we used to sort of trigger me. So yeah, anything that would be, I guess, slowing people down in the practice is something I would always do. And a lot of kind of talk around, whilst people are doing the practice, of we're not aiming for the perfect pose. We're not aiming for, you doing better than your neighbor that's next door to you. We're looking for how it feels in your body, and if it feels good for you, and if it only feels good to, stretch to this point, then only stretch to that point. There's I think in a lot of kind of exercise, in inverted comma classes, you feel that kind of competitive, I want to do more push-ups than the person next to me. But yoga is a very internal practice. And if you can really allow it to be just you on your mat, then you can listen to your body and kind of feel, well, how does that feel for me? And if I do that pose, is it going to make me feel dizzy, or is it just going to be a little test to see how I feel? And maybe speaking to the teacher as well, and letting them know, these are my symptoms. You might see me just kind of pausing for a second. That's just me steadying myself before I join back in with the class. So I think there's a lot of things you can do, but I think it's listening to your own body is the biggest one for me personally, that allowed me to be involved in yoga classes, was to be able to, I guess, have the confidence to be like, this is my practice. This is how I want to do it. It's okay if it doesn't look like everybody else's. I'm here, I'm showing up for myself, and that's the main thing.
Yeah, isn't that the truth? It is. So
Mm-hmm.
you want to do as well as the person next to you, but also you want to do as well as you used to be able to do it. And
Yeah.
so you kind of
Yeah.
have to allow yourself to just be who you are right now. And I think you
Yeah.
made a really good point that communicating with the teacher what your limits are, and as well as maybe looking for a gentle yoga class. Don't try to go,
Yeah.
if you're going to go to a yoga class, don't go to hot yoga, or
Yeah.
something that is really going to push your limits. And they
Yeah.
have those out there. They may not be vestibular specific, but they
Mm-hmm.
are they kind of cater to people with mobility issues.
Yeah.
So
Oh, I
Denise, you
was
go
good.
ahead, because I had some questions for you about that. Are
Oh,
there
yeah. I was
particular yoga techniques or principles that you think align especially well with vestibular retraining? And go ahead, and
Yes,
you have more to say about
definitely.
that.
I think I love what Emma was talking about, but with in physical therapy, the patients want to be like the best patient and work so hard, but it is with the physical therapy for vestibular rehab too, where it is like a slow and controlled process. You can't do too much too fast because the system can become irritable, and then it would be more detrimental. So some people say no pain, no gain, or like work so hard, but it's just not like that. They have to do what's best for their body. So in PT practice, there are yoga strategies and principles, like restorative yoga is really good for vestibular patients. So holding positions for extended periods of time, and any type of position that allows relaxation, allows the patient to breathe and be mindful and comfortable. It will allow the nervous system to calm down. So restorative yoga is really good. Depending on where they are in their rehab process, hatha yoga is good. So slower movements, instead of fast vinyasas, slower transitions, possibly holding for longer periods of time. And then definitely, of course, meditation is one of my personal favorites, like mindfulness, tuning into your body, allowing yourself to feel certain senses. So if somebody does feel dizzy, just if it's a mild dizziness, like see how it feels in their body, have them ease into it, feel it, get out of it if they need to by positional changes or whatnot. But if people do get dizzy, there are some strategies called habituation. So we want a patient to feel a little bit, but not too much. So getting to know their body and their senses, their sensations, what they're feeling.
Wow.
Can I just add as well? I was just going to say, that just reminded me that even if you don't have a vestibular disorder, when you look around a room as a teacher, especially, everybody's wobbling. And I think you think you're the only one wobbling because you're like, I'm the one with the dizziness, But actually, I would look around a room when I was teaching, everybody's wobbling, everyone's trying to find themselves and, find their center of gravity. So it's so normal to feel that wobble. And it's not that you're necessarily, worse at it than somebody that doesn't have dizziness, but yoga challenges your balance system, whether you have vestibular disorder or not. So it's very normal to wobble. I just wanted to add that.
That's a good T-shirt, Emma. It's normal.
It's normal to wobble.
That is good. I'm going to have to remember that.
So, Emma, have you discovered anything? Anything that surprised you about your own body or your balance or your nervous system since you began this practice?
I think the main thing is that really the benefit for me is from the meditation and the breath work. And I came to yoga for the movement, and it has incredible benefits, and it has allowed me, I think, to improve my balance and create strength in my body and flexibility. But the meditation and the breath work and that the kind of nervous system support, I think, is what has given me the biggest gift on over the last 7 years, because it's the thing I keep coming back to time and time again. And whether that's, whether I'm on an aeroplane, whether I'm at work, whether I'm, doing whatever it is, even in situations where maybe it's not dizziness, maybe it's I'm feeling anxious about something, those skills that I've taken are what's probably going to carry me through for the rest of my life. And I originally started it thinking, oh, it's just the movement, I'm just doing it to, improve my balance. But the benefits are so huge on that kind of nervous system and mental health level that, I'm just so grateful for that. And it's not the reason I came to yoga, but it's the benefit that I'm taking away from it. So, I
think vestibular symptoms in general, once we've lived with them long enough, is a really good training ground for how to live with chaos and adversity. I mean, most people that we meet that are in the vestibular community, after we get through the period of hell, they're quite calm and peaceful and joyful human beings. And I think it's like you said, Emma, it's translatable to other parts of our lives.
Well, and we hear all the time about vestibular disorders triggering that fight, flight, freeze response. And meditation can be so helpful in calming the autonomic nervous system. So, I mean, it just seems like the perfect fit.
You're right.
So, Denise, how do you assess when a patient is ready to, go from like chair yoga, for example, or yoga where they're just laying on the ground, to something more challenging where they're standing, where they're maybe standing on uneven surfaces or on one foot?
So that's a good question. We do have objective tests that we test. So we test vestibular ocular reflex, head movements, eyes stationary, balance, eyes opened, eyes closed. But taking into account all of the objective tests that we have, we also take into account, again, the irritability of symptoms. So it would depend on how well they tolerate certain positions for whatever amount of time. And once things start to get easier, so for example, if they start to feel like mat exercises are no longer challenging and they're not symptomatic or they're minimally symptomatic, then we would advance them to sitting, and from sitting to standing. So it's certain objective tests, but a lot of times taking into account what they report and their irritability of symptoms. So how irritable are they? We say minimal, moderate, severe. How long do the symptoms last beyond when they start to feel symptoms? So objectively and subjectively.
That's really interesting, really helpful.
Yeah. Gosh, there's so much for us to learn here. I feel like a lot of it too is just trial and error. I think a lot of us just need to go and give it a shot. And like the vestibular community often says, we just need those little wins. And like you said, Emma, maybe a 10-minute yoga practice instead of a 1.5 hour yoga practice to start off with. What other advice might you give to patients that are maybe a little bit hesitant to get on the mat?
I think starting small is the biggest one. I think starting at home is a really good place as well, because people often feel that's their safe space. When, in my early days of feeling unwell, getting home was like, right, I've made it back. I've been out for the day and I've made it back. So doing it from home, maybe doing it with a friend, somebody that that you can rely on, or if you're feeling dizzy, that they're kind of aware of you and might be able to support if you needed. And then just making sure that you're, I guess, as prepared as possible. So whenever I used to attend classes in person myself, I would make sure that I'd had a small snack so that my blood sugars weren't going to drop. I've got a bottle of water, I'm wearing comfortable clothing. I've picked a space in the studio that, I feel comfortable in. It's just, I think it's setting yourself up for success, and knowing that even if you have to stop during the class, then that's okay. If you do want to go to a class in person and you get 15 minutes in and you think, I'm really dizzy, most yoga teachers will be absolutely fine if you just wanted to sit and just meditate and relax for the rest of the session. I would never have had a problem if someone would have said, do you know what, I'm not feeling so well, but I'm going to stay. I'm just going to sit and, do some breath work. That's totally fine. So I think taking the pressure away from, as we were saying earlier, that needing to be perfect and to do a full hour session and for it to be the best class you've ever done. I think just showing up, doing 5 minutes, 10 minutes, doing it gradually is what's going to pay off, because I've gone from doing it at home in the living room as a 10-minute session on the floor to now teaching classes for an hour as the teacher. So, you can see how that transition can happen, but it takes that first step. And a big part of it is just being that little bit brave, pushing yourself just that little bit, which I think a lot of vestibular patients, they realize they have to do. So, for example, the first time you get on a train, the first time you take a flight, you have to just be willing to just go, okay, I'm going to push myself a little bit today. And that little bit might just be a 5-minute meditation. It might then be 10 minutes of a yoga flow. And then one day it might be 60 minutes of a vinyasa class in person. But it's just that first little step.
Emma, do you, I know people are probably going to be wondering or wanting to find out, do you do privates online?
So I've not actually taught for a little while now, because I got a new job over here in Melbourne, which has taken up a lot of my time. I've been doing my own practice, but this has given me a bit of a nudge actually to get started again and get back offering classes, because it's been on my mind for a while. So I will be, yes, offering, meditation is probably one of the biggest things that I really love leading, with some gentle stretching, but the meditation for me is a huge part of what I like to do, especially with the dizzy community, because a lot of it is around feeling safe in your body and being prepared to go into certain situations. So, if you've got an event coming up, if you've got some travel coming up, being able to, I guess, regulate your nervous system and put yourself in a good state to be able to go out into the real world and do these things. That's something that I'm really, really passionate about. So yeah, watch this space. Hopefully we'll have some stuff coming really soon.
Yay.
That's exciting.
Yeah. So Denise, question for you. Can you think of maybe a success story of a patient that you've had where you combined PT and yoga practice, and it had an impact? It helped them control their symptoms. It led to improvement in function. Is there any fun success stories you can share?
I would say the biggest success, I think, goes along with what Emma was saying, not just a single case story that I want to single out, but just the whole meditative practice that you could bring to vestibular patients that has made a world of difference. People don't really understand how much that has an impact on their central nervous system and their day-to-day life. It's just amazing once you start talking to people about being more mindful, tuning to their body, slowing down, and actually practicing meditation, whether it's on their own, starting out small in a safe place, like Emma was talking. I even talked to patients about just try a minute. You can do anything for a minute or even 30 seconds. Because again, when people hear meditation, they think, oh, they have to sit somewhere for 30 minutes or a couple hours and just sit. Again, it's an educational piece, talking to patients about the importance of it and how to do it. And again, if they can just create a space that's safe for them, or if they need a buddy, to help them, but anything, just baby steps, start with a minute. You can do anything for a minute. And I really think that part of the yoga practice has made a world of difference with vestibular patients.
Yeah, absolutely. Kimberly, I have to ask you, do you have the same experience that I do when you put out your yoga mat and you get on the floor? Do your cats come over and they just have to be there?
Actually, I go out to the garage, and
Oh.
only because all the other stuff is out there too. So, but if I lay on the floor just in general, yes. They usually actually like to, I don't know why, it's like my shirt makes a tent and they want to just crawl up the shirt, which is fine because it's cozy. It's a
That's
win-win.
Yeah. I have a little, it's a little battle of wills. My dog, actually, Xena, runs over first and she's like, oh, you're on the floor. Pet me, pet me, pet me. And then as I'm doing my my yoga, the cats will come over.
Oh,
And
Oh,
I
that's
have
really
this great
sweet.
picture of I'm doing, I'm not good with the names, but where I'm on my hands and knees so that my back is flat. And
like a tabletop.
yeah, like a tabletop.
Yeah.
And my cat jumped on my back and just laid there. She's like, oh.
Oh, that's really
That's a
cute.
good spot.
Anyway, I wanted to
Oh,
point out, and we'll include it. We'll include a link in the description of our podcast. But Vita has an article about gentle yoga for balance that Emma and Denise have contributed to. So check that out. It's helpful. You can download it, print it out, and bring it to your yoga teacher if they're not familiar with what a vestibular disorder is, and show them these are the kinds of practice that or poses that work for me. Can you can you design a class that is for people like me, and maybe we can get more gentle yoga classes going so that everybody,
yeah,
more
that'd
people
be amazing.
manage those. So
Yeah.
well, thank you so much, Emma and Denise, for
Thank
sharing your
you.
experience and your expertise. I
Thank
thought it was
you.
really wonderful to combine both the yoga experience with the vestibular rehab perspective.
Thank you.
Yeah.
incredible.
Yeah.
Thank you.
Thank you so much. It's been great to talk about it, and I think I owe so much to this journey, from yoga and meditation and breathwork. So I will, say it till I'm blue in the face. Like I think everybody who is struggling with dizziness, even if it's just taking 5 deep breaths in through the nose and out through the mouth, if that is all anybody can manage, that's going to help so much. So yeah, I owe a lot to yoga for where I am now.
Well, everybody
Great.
who's listening, after you're done with listening to our podcast, pull out your Calm app, your Headspace, whatever apps you have, and take 5 deep breaths.
Mm-hmm.
All right.
Yeah,
Thank you,
great idea.
everybody. And
Thank you.
you have a wonderful rest of your day.
Thank you.
Thanks.
Bye.
Bye.
Thanks for tuning in to ICU this month.
We hope this conversation sparked new understanding of the vestibular journey. And for all of our patients out there, leaves you feeling just a little more heard and a little more seen. I see you.